Pakistan has the highest rate of diabetes in the world. Congratulations, we're number one. Muh meetha kar lo. With World Diabetes Day coming up, we thought we would take a closer look. Standing at an alarming 30.8%, the percentage of adults with diabetes in Pakistan has been dubbed a health crisis, an epidemic, and a disaster in the making. The International Diabetes Federation, IDF, released its most recent world rankings in 2021, and we topped the list, beating out Egypt and Kuwait. In terms of pure numbers, we came in third, with India and China edging us out, although both have vastly bigger populations. In 2010, Aga Khan University warned that diabetes was on its way to becoming an epidemic in Pakistan. Then, in 2017, the NDSP, the National Diabetes Survey, confirmed we had, in fact, reached epidemic proportions. Predictably unpredictable, Pakistan has actually surpassed all forecasts by miles. In 2006, experts thought the diabetes incidence might increase to 14.5 million people by 2025. Right now, and it's 2023 by the way, we stand at approximately 33 million people with diagnosed diabetes, with millions more estimated as being undiagnosed. Diabetes can lead to blindness, heart disease, kidney failure, and foot amputation, among so many other potentially fatal complications. So this is a big deal and a massive strain on Pakistan's already struggling healthcare infrastructures. The economic cost of the disease to Pakistan was 428 billion rupees in 2015, so that's likely to have grown significantly. In 2021, an estimated 400,000 people died from diabetes in Pakistan. So what's causing this worrying boom? Samcho explains. Diabetes refers to a type of disease that affects the level of glucose or sugar in the blood. It manifests in high blood sugar because insulin, the hormone that controls blood sugar, is in short supply or is being misused by the body. Chronic high blood sugar can wreak havoc on your body's systems. Diabetes has two types: type 1, which is genetic and cannot really be prevented, and type 2, which is the most common type of diabetes. Many in Pakistan know type 2 diabetes colloquially as sugar, partly because of the connection with blood sugar levels and partly because that's the first ingredient people try to control when they're diagnosed with it. This perception's not exactly wrong, but there's more to diabetes than just sugar intake. One less teaspoon in your chai isn't enough to protect you. Thing is, diabetes is a chronic condition, meaning once you develop it, you have it for life. There's no cure, just ways to manage it and the possibility of remission. That's why the focus must be on prevention. Risk factors for type 2 diabetes, things that make it more likely to occur, include obesity, a family history of the disease, an inactive lifestyle, and once upon a time, old age. However, more and more children and young people are showing signs of prediabetes and diabetes, especially in so-called developing countries like Pakistan. Diabetes is on the rise globally, and age isn't that great of a predictor anymore. Developing countries have faced rapid urbanization and socioeconomic development, which has replaced traditional diets and lifestyles with unhealthier ones. The main culprits being food and drinks high in trans fats and sugar, along with stress, smoking, and a lack of meaningful exercise. This problem isn't new here. Pakistani doctors have been warning us for a while. In Pakistan, there have been 5 national action plans for diabetes management since the 90s. But talk is cheap. Action on part of the government has been lacking. Implementation has been minimal at best. The public spending on health has always been insufficient, and the upcoming budget isn't looking promising either. Another unfortunate risk factor is South Asian genetics. Even at a lower weight, South Asians are likely to develop diabetes faster. Studies show that our bodies accumulate fat in places that are more likely to disrupt insulin production. Other factors, such as marriages between relatives, less lean mass, and high-carb diets, have made our communities the perfect breeding ground for the disease. South Asians are just at a disadvantage here. In India, where diabetes affects an estimated 101 million people, certain types of interventions have shown to be more effective than others. Take the success of ClickMedics, which provides virtual medical consultations to vulnerable and rural patients. The e-platform makes it easier for doctors to see patients while also lowering the cost of the consultation, which can be a huge barrier for many Pakistanis. In a study published by the Commonwealth Fund, the authors found that innovation usually begins and is scaled up in the private sector, because partnerships within the public sector can take time to develop. And that's true for Pakistan too. Where the federal government has been slow-moving, the private sector has attempted to fill in some of the gaps. The Chugtai Lab and the Y.PK both have diabetes care programs offering discounts for a range of services, as well as diabetes management plans. Universities can also play a huge role. Bakai Medical University, a private university, has pioneered and established 115 diabetic foot clinics since 2007, placing emphasis on community-level solutions. Bakai Medical's Institute of Diabetology and Endocrinology, a local member of the IDF, has even launched a range of therapeutic shoes to protect diabetes patients from eventual foot amputation. So while the government may be characteristically absent, the experts are still on it. People aren't on their own here. One important thing to note about the rankings is that Pakistan's diabetes data is widely and recently recorded. The IDF used recently updated data from Pakistan's 2017 diabetes survey. For comparison, recent data extrapolations claim there are actually 36% more people with diabetes in India than the IDF stated, due to less recent data. Dr. Abdul Basit, the Secretary General of the Diabetic Society of Pakistan, says that it is because the Pakistani health community stays so vigilant and active in conducting nationwide diabetes surveys that these numbers are so widely known. We have a diabetes registry in the works, also started by Dr. Abdul Basit and his colleagues, to keep information as up to date as possible. He believes Pakistan's case isn't particularly special and is in line with global trends. Still, even within larger contexts, Pakistan is undergoing a massive health crisis. Approximately a third of the country does have diabetes. But all hope is not lost. Unlike a lot of other problems plaguing Pakistan, this is one that citizens have relatively more agency in. Raising awareness actually helps significantly, and you can start within your own families because attitudes affect outcome. Doctors say they are usually met with a skeptical audience in Pakistan when trying to urge them to make healthier choices, and the news reported in 2018 that only 3 to 4% of diabetics actually use the insulin prescribed to them. That attitude problem needs work. We need to reframe it, away from the fearfulness of being denied indulgent foods and towards the joy of living a healthy and energetic life. That doesn't excuse the government, however. A large population of people simply cannot afford treatment. There have been a few provincial attempts at easing the burden, such as KPK's Insulin for Life program, which provides free insulin for type 1 diabetics, and the Punjab government's Prevention of Non-Communicable Diseases program, which has established cells and screening centers across Punjab. But this is not enough, and is clearly not having enough of an impact. Government should be pressured to do more for each of its citizens. Not just lip service this time either, but actual concrete national policy communicated effectively to the provincial level and followed through with funding by successive governments, not simply discarded each time a government changes. Take Nawaz Sharif's forgotten National Health Program or Imran Khan's Sehat Card, both aiming to help the most vulnerable populations of Pakistan, both gutted before they really had a chance to make a difference. They also need to implement more education programs in schools, make these life-changing drugs more accessible, and a host of other measures experts have been recommending for decades. Even simple awareness campaigns can make a world of a difference. Right now, Pakistan spends less than 1% of its GDP on healthcare expenditure. This is a long-term challenge that needs to be tackled with long-term strategy, something our governments have had a terrible track record with. This issue isn't just about personal choices, like it's often framed to be. Take the issue of walkability. Pakistan is not designed to be friendly to pedestrians and severely lacks in safe outdoor exercise and recreational facilities. Despite a relatively small amount of the population owning cars, our cities are car-centric, meaning pedestrians have to go out of their way to walk around traffic rather than walking being built into the design of the cities. That's something that lawmakers and developers should be accounting for. We're not asking for too much when we ask for our urban spaces to be designed for the good of the people. So far, due to a lack of allocated funding and a lack of will, as well as several regulatory hurdles, Pakistani representatives have objectively not done enough for their vulnerable populations. It's in our best interests for everyone to be on the same page here. Otherwise, this spells disaster for an already struggling nation, and nobody wants to deal with another disaster. Remember to stay informed about the health and status of the nation with Samjho. Do you or your family have diabetes? Tell us about your experiences in the comments below and subscribe for more.